Good morning. Today I will talk about different tips that you can do to help prevent knee pain. I'll go over different looking at your shoes, support, the exercise you're doing, and just some general health tips. So first, let's talk about shoes. Wearing the proper shoes is important because if your shoes aren't worn properly, if you don't have the proper shoes, then that can affect the knees. So I had talked previously about how when the feet roll in or roll out, that can affect the knees, and your shoes can contribute to that. So if they are not appropriate for your feet, they can actually push your foot farther in a direction that you don't want it to be. So for example, if you have a high arch and you have a shoe that's a stability shoe, which has extra support on the inside, it can push your feet out even farther and cause issues at the knees. Also, if you have a shoe that's worn down, that can also contribute to pain. So when you're wearing your shoe and you're walking the way that you typically walk or exercise, the shoe will wear down in that particular spot. So eventually, it will exaggerate those motions. So you want to make sure you're changing your shoes regularly, every 6 months, every year, depending on how often you use them. That can help to prevent knee pain from developing. You also want to make sure the shoes have the appropriate shock absorbing capabilities to them. So if you're doing a lot of jumping and activities, something like a hiking shoe might not be appropriate because it has a harder sole to it. So you want something like a running shoe where it's a little bit softer and it can absorb that shock when you're jumping or doing some running activities. Also in the shoes, you want to make sure you have the proper support when necessary. So if you have a low arch or even a high arch, proper support might be necessary to make sure that the feet are in alignment and then your knees are getting pushed out or in. Next, I'll talk about exercise. So first, you want to make sure you're exercising both of the sides of your legs evenly, or the sides of your body. So if you're doing 10 lunges on one side, you should also do 10 lunges on the other. So making sure that you're exercising them evenly so there aren't any imbalances that can create knee pain. Next, I want to talk about new exercise routines, or if you're trying to increase your muscle or your endurance or something, you're changing your exercise. You just have to be aware of that because if you do too much too soon, that can also lead to knee pain. So look at your intensity, your duration, the activity you're doing. So if you're changing something, gradually increase it, gradually introduce new activity. That will put less strain on your knees, and then the muscles and everything will be able to adapt a little bit easier to prevent that knee pain. Next, I'll talk about how you are squatting and how you're lunging. So I've talked about this in a previous video, but if you're squatting and your knees are pointing in and then coming up when you're back up again, then that can create some imbalances and your knee is not tracking properly. Same thing with lunging. When you lunge forward, your knee should be straight forward. Now, if you are having an issue there, it could be due to muscle imbalances. So a physiotherapist might be able to deal with that. Or it can be coming from your feet and that your foot is rolling in or out and it's contributing to that. So always be aware of it, of what your knee is doing, and you can always seek professional help if necessary. Last part of the exercising is the surface that you're on. So if you're on a concrete sidewalk on the road constantly and you're running, there's not a lot of shock there, and shock absorbing qualities. So your knee can really be affected after even after one exercise or after a longer period of time. So just be aware of it. Sometimes you may need to go onto the grass or use a yoga mat for your activities, carpet. Try and use softer surfaces when you can. Your general health can contribute to knee issues as well. Making sure you're eating properly, drinking enough water, giving yourself the proper rest. But in addition to that is also recognizing when you need to seek professional help. So if your knee is starting to bother you, and the rest isn't helping, make sure you talk to somebody and get it addressed quickly, because the longer you wait, the harder it is to get rid of it and the more damage that could be done. But it's always important to address it as soon as you start developing pain. So that could be your family doctor, maybe a physiotherapist, chiropractor, even if you have support like orthotics, maybe they need to be updated. Again, checking your shoes. So lots of things that can be done, but always recognizing when you have pain and addressing it as soon as possible. So those are a few tips on how to prevent knee pain. And if you have any questions, feel free to reach out and I would be happy to help.